Hey, Leanne, how are you?
Good, how are you?
I'm doing well.
Good.
All
Sorry,
right.
I have to
No
leave
worries.
in
I
a minute.
think we're live. First time. So,
Yay!
no worries. I appreciate everybody being here. I know a lot of people said that they were going to show up. So, um, yeah, I'm looking forward to it. Again, this is my inauguration of my organization. And I just wanted to welcome everybody. There's a lot going on in the world, and we can spend our time in various places. And me starting this organization into my health, I felt was very beneficial to not just myself, but those around me. And so I wanted to share, my experiences and myself with the rest of the world. And so, what I'll do is I'm going to share my presentation, and Leanne will be my support, my right hand man when it comes to the Q&A section towards the end of the presentation. So we'll take all the questions at that point in time, and then we'll just move accordingly. So I will share my screen, and then we'll just jump right in it. Hopefully, I'm doing this right. What I want to bring up is my presentation. And starting it from the beginning. Leanne, you'll be my point. Can you hear? Can you see the presentation? Just want to make sure you can see it, that everybody else can see it.
Yes, I can see it.
All right. Can everybody else see it? Leanne, if you can just let me know if people respond in the chat and they can see it. Any responses, or we're good?
Nope, nope, I look for good.
All right. All right. So again, this is Veronica Wynn, inaugural live stream with Into My Health. So this is the agenda. And really, the big question is why, right? Why you guys want to know why am I doing this, and what stemmed from all of it? What motivated me to do all of this, right? Sorry. So, right, this is where it all started. 911, what's your emergency? Right? Obviously, I wasn't the person who made the call, but in January 2020, I was in a car accident. It was a multi vehicle car accident. Um, and I thought, I was shocked to say the least, but nonetheless, I was in a car accident that was no fault of my own, and kind of went through the journey of what's next. A lot of people, when it first happened, they're like, "Oh, you'll just bounce back and you'll be fine," but that obviously did not happen. And as we know, the pandemic was happening at this time. So life was happening in uncharted waters. You had the pandemic. I had my son in childcare. I was going to doctor visits. And we were living in a small apartment, and we needed to shuffle around, right? In order for us to really make things, helpful and beneficial to all of us, there was just a lot going on. So it was crazy. So I'm sure you all know that as well, because most of us were around during the pandemic. And so we just kind of move accordingly. We wasn't familiar with the space, but we kind of moved forward with it. And this is just me, kind of like in isolation from most of the world, like we all were, right? We all had to go home and kind of sit in isolation. We all got that same memo: go home for 2 weeks and we'll see you back in 2 weeks. But that nonetheless did not happen. And so, yeah, it was me kind of running around, going to different doctor's appointments, doctors telling me to take all these different medications, trial and error, trying to figure out what's wrong, diagnosis. And it was just interesting because, you're trying to figure out what's wrong with you, right? I went from being a very active person to now I have this potential issue. And what does that mean during a pandemic with a small child? And, the world is just going, a bit crazy. But I didn't let that stop me. I just kind of, if you were able to read my story on the website, I kind of talked about that where, you know, most psychologists probably wouldn't say, to be numb or something like that. But that's basically what helped me kind of move through this journey so that I can get the proper care and, move accordingly. And so that's what I did. And that's how I got the proper care that I needed. But I was always thinking in the back of my head, like, how many other people are going through this, right? And what can they do? What can, potentially what can I do, right? But that wasn't at the forefront. But eventually that came to surface. So I get my final diagnosis. It was kind of a shock, and because they told me that you have permanent injuries, and that it just didn't register. And so anybody else that might have a chronic issue or illness in their family, whether it's them directly or another family member, that's kind of hard to take when somebody's telling you, especially when you are active or whatever you have going on in your life. Life is about to change, right? So the diagnosis was provided, and then it's just, so now what, right? And so now we have to start to think about changes and what's happening. And now I have to rethink how I think about the world and how I show up and what I do in this world. And so I'm just thinking, because my injuries, as I mentioned in my story, literally made me sit still. Like, I can't do all the activities that I used to do, such as like running, um, going hiking and long walks and stuff like that. I'm limited to what I can do. But nonetheless, I kind of came up with some other options to do as I'm kind of moved through my journey. Right. And so tell me more. So many people probably see me. And so when this all first started, those glasses, those black glasses, the doctor sent me home and I had to wear those. And I tend to be in glasses almost all the time when I'm in light or sunlight. And so I had to come up with creative solutions just because I had, light sensitivity to noise. And so I'm like incognito. And so when you got your families and friends, and I don't think they know how to respond when you tell them what your issues are. And at least my family, we try to be lighthearted and, try to find a joke. So, I mean, I've probably heard things from like, you're hiding from like the FBI or the CIA or something like that, all the way to something more lighthearted where it's like, maybe you are a movie star or something like that, because I'm like covered up, sunglasses, hat almost all the time when I'm out and about. But that's more for me to protect myself and be able to have a more, enjoyable moment while I am outside. So I'm not hiding from anybody. It's just what I need to do to kind of move through life. So then this is a time to reflect, right? I'm thinking about my life, the world around me, because again, we're still in the pandemic. And I'm thinking, what can I do, right? Because my family, we don't let anything stop us, right? I had a family member who passed away a few years ago from a terminal illness, and you would have probably thought I was lying to you when I said, "Oh, he's about to die," when that because he was always out and about. The family had him out and about, but nobody saw the behind the scenes of him needing to take rest here and there or taking the medications. Like, you don't see those. You just see those pockets of moments where that person is kind of out and about. And so I kind of think about his situation, and I think about others that might have chronic issues or just issues in general, or may not have a chronic issue at this point in time in life, but they have their health and well-being issues. And so how can I better show up in the world? And so I started to reflect and think about all of those different things and try to wrap it up in like one little bell. Like, what do I like to do? What am I going to move forward from a personal standpoint, professional standpoint, and just life in general? So there was just a lot of time to think. When you're unable to move and do the things that you used to do, you have a lot of time to just really think and kind of move through those things. And also, while I was, reflecting, right, you're kind of thinking about the past, and then the present, and kind of moving forward into the future. And so one thing that I started to think about was the healthcare system, right? I started to think about the issues that I was having in the healthcare system. I was listening to other people, stories in the healthcare system. Um, and just so you all know, I love the healthcare system. So as I talk about the healthcare system, it's not a knock against them, but it's an opportunity to shed light on one of the many issues that we have kind of going on in the world, right? And so before the pandemic, right, they were in a fragile state in terms of shortage of employees, which a lot of industries can talk about that, um, and not having the right resources and other things along that matters and the finances to kind of move things forward. And they had, similar to what other industry had, was they had the great clinician resignation kind of going on. So they were in a very fragile state before the pandemic. When the pandemic happened, they were even in a more fragile state. And as many of you might know, a lot of them came out of retirement because people that were already in it had left, or maybe they became ill, family became ill. So we were, as an industry, scrambling, looking for help, right? And that hasn't changed, right? And that's like the emergency of the healthcare system, right? There's an emergency, there's a crisis with the system, and kind of thinking about how can we help that, right? Or how can I help that? And so I just wanted to share some data and facts around that, right? And kind of looking at where the healthcare system sits. So this is just a quick slide from the CHT Healthcare, and kind of looking at some of the physician specialties that are least likely to make a career change. Internal medicine is the least likely, but if you start to go down the scale, it starts to get shorter and shorter, right? And so when we talk about like mental health, like psychiatry, psychology, that's very small. So that means like 80% of them are looking to leave their industry, right? The same thing for, pediatricians. I just made my son an appointment today. Office is closed, right? And so people are deciding to shift gears and make decisions. Same thing with family medicine. A lot of us need to go to the doctors just for general care. But if more than 60% of them are looking to leave the system, what does that mean for us? And then just here's another slide, just kind of talking about the reasons behind some of those changes. And again, this is specific to physicians only. And it just kind of shows you the grid here. And most of those people, they're in their mid-career, right? Late career. So those individuals that have a lot of experience. So if a lot of those are looking to leave the industry, what does that leave us? That leaves us with young talent. It doesn't mean that young talent can't offer services, but it leaves a gap of experience. And again, it's not just the healthcare system. I work in insurance. We face the same situation, right? There is a gap across industries, and the healthcare is no different, right? And these are some examples, right? Opportunity, work-life balance. So again, another reason why they're leaving the industry, and a more in-depth reason. And then this is from the National Institute of Health. They have many subsets, and this is just one of them. And then just another opportunity to kind of look at supply and demand from a healthcare system standpoint and what that looks like. So again, this one right here is for family medicine, and it just shows the gap over the next 10 years of what that looks like based on supply and demand. Same thing with registered nurses, general surgery, nurse practitioners. It's a huge gap. And so as we saw with those slides, we saw that was like a huge gap, right? Nurses were the hugest gap, right? And depending on who you talk in the healthcare system, some would say the nurses are the ones that do a lot of the work. But nonetheless, they're all needed, right? Whether you're a nurse, physician, or some other role within the healthcare system, having that gap like that is going to be detrimental to the healthcare system that's already fragile. I think overall, they're looking at, there's different studies out there that'll give you different numbers, but a lot of them are hovering at least over 100,000 medical professionals short within the system. So that's a lot when it comes to the care that we would need. And then I also thought it was important to kind of put in the policy change that just went in July 3rd, mega bill, big beautiful bill. It's got a couple of names, but nonetheless, the impact that that has, this is some data from NPR, and what's the impact that might have. You know, many people will have to work to stay on Medicare. Less cash means less care. ACA, which is the Affordable Care Act, coverage will be harder to get and retain. Those on Medicaid will have to pay more to see their doctors, and then some immigrants will lose access to subsidized ACA plans. And then this is another slide just kind of breaking down furthermore the figure 930 million over, I think, a 10-year window. You're talking about 80 million people, and the list goes on, right? So 17 million by the end of 2034. And then what does that mean, right? There's always a cost, right? So I have a degree in economics, so I'm always thinking about like, what's the economic cost? And so even though that these individuals may lose their insurance, somebody has to pay for it, right? And so at the end of the day, it becomes, you know, taxpayers paying for these costs on top of the increased costs of insurance. So you have to think about, okay, what does this all mean for me, right? And then we look at, you know, what are some of the causes for healthcare problems? And a lot of times people think it's just genetics, and listening to doctors. There can be different foods of thoughts, right? Although genetics is 30%, some feel you can turn it on and off, even if it's genetics. But the biggest thing is behavior, right? We create our own problems, right? So you got a fragile healthcare system, and then we're creating problems, adding to the problem. And so that's just going to exacerbate what's going on in the space, right? So health and economic costs from a chronic disease standpoint, you're looking at 100 billion alone just for heart disease, diabetes. You're looking at 3 trillion by 2030, and that 1 in 3 Americans will have diabetes. So between heart disease, diabetes, and cancer, those are going to be the leading cause of chronic diseases in America over the next like 10 years. And then this is just some more stats, right? 6 in 10 adults, basically 60% of adults are going to have a chronic issue at some point in time in their life. And then 40% is going to have 2 or more, right? So when you think about all these things, you have a fragile system. We have some things that we are contributing to ourselves from a behavioral standpoint. And oh, by the way, we'll likely have a chronic issue, right? But study shows that lifestyle changes can reduce that by 80%, right? And so when you think about that, you wonder, okay, what can I be doing differently? And so we also look at the gaps in the chronic disease prevention and management standpoint. So you got the healthcare system who's trying to do their job as best they can with the resources that they have. But then it's us on the other side who, you know, need additional support and additional help. And there's this gap, right? And so what do we need to do within that gap? And so I'm thinking, what can we do within that gap, right? We can all either complain about how the system is broken, or we can try to choose to do something to fix it. And so I chose to do something to be a part of the solution. And I started to think about what are some new opportunities that I can do. I think oftentimes we think about the big guy who might have a big pocket or something like that, that's going to be making all these moves. But we think about in history, a lot of times it's that small gem in the corner that we all know one or two, right? That's making some great impact within the community. And that's what I would like to see happen within my organization as I, you know, continue to bring awareness of what I'm trying to do within the community and beyond, and just help each other out, right? Because as much as we want to say that, you know, we want to depend on the healthcare system, or we want to depend on that, the only person that we can really depend on is ourselves, right? And so we all, excuse me, We all want to be able to lean on somebody, but we also need to learn how to work together, right? We're all interdependent on one another, but if we're heavily leaning on one side versus the other, there could be some missed opportunities. And I would like to be able to kind of close some of those gaps with those missed opportunities by launching, my health and wellness business. But before I started out a business, right, I'm just an everyday person, just like you guys, right? So, I like to travel. I like good company. I like a good romantic comedy. Love the arts, and I gotten more involved with the arts um, with the change in my healthcare, right? Because, like I said before, I can't be as active, so I got to look at other solutions. So I enjoy singing and dancing and stuff like that. And that's just a part of my family. So I get to pick up some things that has been done in my family and kind of carry those traditions on and actually create some memories that we can kind of hold on to. But just the everyday person, right? I'm a mom playing with my kid, like to go out and have a good restaurant. I'm big on drinking a good cup of tea. Um, Big on old school music. Earth, Wind, and Fire is one of my favorite groups. Um, but yeah, just an everyday person, right? But there's also a professional side to me as well, right? So I have that experience, right? I have decades experience working in the insurance industry. I have within that working as, a mentor or a coach. And a lot of us probably have done those same experiences, right? So when people go into health and wellness coaching, they come from various backgrounds. And so my background so happens to be insurance. Um, but yeah, I've had the opportunity to coach individuals, whether personally or professionally. And as I continue to kind of move through the journey and try to figure out what I'm going to do, a lot of people when I was talking to them, because I'm always giving my ear to listen to people and provide them with guidance and empower them to be the best version of themselves. They're like, you should be a counselor, you should be a coach, you should be this in this type of space, right? And so it just all made sense, and I just felt like it was marrying well a lot of the things that I like to do, because I love the healthcare system, I love what's happening in it, and I feel like this is an opportunity for me to support the system. I love to learn, I love to educate, I love to research, I love to advocate, right? And so, with my experience and all of that, and then also with health and wellness coaching, only 10% of individuals in that space actually has formal training. And I'm actually going through formal training at Emory University. So I'll be a part of that 10% that's getting formal training, right? So you'll get somebody with um, great credentials, already have experience within the field, and just has a passion and a drive. If you talk to people that has known me closely and that has worked with me closely, they'll say the same thing. And so then I opened my doors. I said, let me open up this business into my health, right? I was very excited, very nervous, but more excited than anything because I'm very passionate about it. And it feels easy and natural, right? Because I've been doing this for so long. So this is an opportunity for me to be able to do something that I've been doing over the years, on and off, or, in between activities, or just talking to somebody here and there. Well, now I get to do it full time, right? And now that's something that I'm going to look forward to doing. I'm enjoying. I've been talking to a lot of people. They're very excited about the opportunities that this will bring. And I hope that all those who are listening in will see an opportunity as well. And so before I was able to, as soon as I launched my business, it was interesting because I started to get all the spam emails and all that stuff. And one of my favorite ones is that I got one that I was quoted like a song, a love song. And I'm like, I don't have any love songs. So this picture down below, that's why the screenshot, that's all I had on my page. But it was just kind of interesting, like the universe trying to, or energy trying to like, delay you from doing what you're trying to do. But on the same note, like right after I got all of these spam emails and phone calls and stuff like that, I got some messages from other spaces that were just like, you're needed. This is why this is happening, right? Because you're needed. You have something good to offer, right? And so I just thought that was interesting that I had this, and then I had those messages of, that positive outlook at the end of the day. But nonetheless, I also know that there's a lot of people on social media and that I listen to, and they kind of share these similar things. And so I just found it to be interesting. I didn't know what happened so fast, but it's kind of like you get in your driver's license, and that driver is like, "I'm a new driver, give me a break," type of thing. And it's like, nope, you are just the average driver. So I just feel like I've been welcomed into the space very nicely. Yep, so that's my scam call. So the email's coming through, right? So, what's health and wellness coaching? So, before I wanted to dive into what I can offer, I thought it was also important to kind of talk about health and wellness coaching. So, really, health and wellness coaching is kind of client centered, right? It's about you, the client, and me empowering you to kind of come to your end result of what you want to learn. It's also about focusing on change and behavior, right? The whole point of you showing up for coaching is for you to take accountability and for me to take accountability for supporting you, but you taking accountability to take an action. It's also based on strength based, so we're not going to sit here and talk about all the bad things that you've done or all your weaknesses, right? I'm a strong believer on positive psychology, and I think everybody has strengths and weaknesses, but if we focus more on weaknesses, and I think that as a society we tend to focus on what's wrong versus what's actually working and what's good. So I prefer to focus on strength based learning and change. So when you focus on that, you get better outcomes. um, and then just kind of goal setting and action planning, I think that's important. Because if you don't have a goal, then if you don't have a SMART goal at that, right? If you don't have a SMART goal, then what are we doing? And then just, we're not a substitute for the medical system. As I mentioned earlier, me being able to work alongside the medical system. And if you're not in the medical system, but you know that you have some health and wellness goals that you want to achieve, we can still work together. There's 4 pillars as a health and wellness coach. So it's about being mindful and present in that process. It's also about being self aware. If I'm aware, then I'm helping you be aware. Me being socially aware, making sure I'm managing those relationships, right? And authentic communication. As I get the opportunity to work with many of you, I believe in authenticity, like to be authentic and not want to kind of sugarcoat anything, because that doesn't help you as an individual. Obviously, being respectful and professional, obviously, but it's important to tell people what they need to hear, so that they can make the right decisions in their space. But for health and wellness coaching, it's really you in the driver's seat and me helping to facilitate you get into the next stage, whatever that might be, right? Everybody's on their own respective journey. So whatever that might be. So the space is always safe. Um, and I don't do any judgment. I make sure that you feel comfortable in the space and you feel open and willing to talk about anything and everything, because I want you to walk away feeling empowered, feeling good, feeling like, okay, what's the next step? What am I ready to do now? So, what does a health and wellness coach do? Right? We help you identify beliefs and values and visions, develop an action plan, provide education and resources, offer support and encouragement, help clients overcome obstacles, and celebrate even the smallest wins. Um, yeah, I know some people, professionals, when they become new into this to a work environment, they're looking for that big bang. But those of us that's been around for a while, we know it's not about the big bang. It's about those little wins that add up to the big bang. So even in the health and wellness coaching space, and as you as a client working with me, you'll see that I will help you to celebrate those smaller wins. And sometimes that can be challenging for people because they sometimes are just looking for that big win, but it's really not. It's those little things in between. And then at the end of the day, you realize, oh, wow, I actually did what I was supposed to do. Whereas if you looked at it at a bigger picture, it might be challenging for you to kind of overcome that goal or that challenge. But it's important to kind of break those down so that you can get to the next level. And I also wanted to kind of talk about the difference between coaching and like other spaces, right? Sometimes coaching can be overlapping in other spaces, but really coaching is about the present and it's about coming up with some solutions. Whereas like coaching and consulting, we're talking about past problems. Now, that's not to say that you can't bring up something from the past to help you move forward in to present or to provide relevancy. Um, that's not a problem, but it's really focusing on the present so that you can move forward with some solutions. And then I also wanted to bring up health and wellness coaching in like insurance spaces. So health and wellness coach is considered like a category 3 service. And that's essentially mean that it's emerging service. A lot of them are starting to see the value in it. And especially with um, the lack of resources or support that they have, right, with the shortages, if they can have a health and wellness coach by their side helping their clients, um, it would be a better outcome, right? But that's typically not covered. But there are some codes and ways that it could be covered. That's something that you would have to discuss with your provider. I don't have an answer for you on that one, but I did provide the codes and stuff like that that they do typically use. And so I focus on 8 dimensions of wellness. A lot of the coaches' websites that I've kind of reviewed, a lot of them just kind of focus on the physical and emotional well being. Whereas I try to go a little deeper on the 8 pillars because if one of these are out of line, and they're all interdependent on one another, then it's likely to make one of the other wellness factors fall out of line as well. So for me, as a wellness coach, I want to make sure that we're addressing the holistic approach and not just focusing on like the physical and the spiritual and the emotional aspect. I think those are great top threes, but I think we also need to focus on the entire person and all the dimensions that make up you as a person and overall well-being. And then I just wanted to kind of share some fun facts just because we are here on this day. So today is July 7th, and we're at 7 p.m. I'm a nerd like that, so I was looking to see what's happening on this day and how it can relate to what we are talking about. And so today is also Global Forgiveness Day, and it's all about, for just letting go, whether it's you needing to let go of something that maybe you've done or maybe somebody done something to you or whatever the case may be. Like this is a day of forgiveness, and so it's important to forgive. And it kind of goes back whether you're talking about the Bible or to the Quran. Forgiveness has been talked about in various aspects, whether in religion or not in religion. And then at least that's where it started. And then it kind of trickled down. But the one thing that I wanted to point out here is the forgiveness speech that Nelson Mandela stated when he got out. He said, when you intend to forgive, you heal part of your pain, but when you forgive, you heal completely, right? And so I think that's important to kind of have in play. And I wanted to give some impact of what it means to forgive from a health standpoint, since I just talked about those wellness dimensions, right? So from a mental health standpoint, it helps reduce stress, anger, depression, states of anxiety. And from a physical standpoint, it can lower blood pressure and improve cardiovascular health. And this is not all inclusive, but these are some of the things just by simply forgiving what this can do to your mental health. So I thought that was kind of timely and important to kind of share what we're doing. And then another thing is about 777, right? It's about the fostering understanding and reconciliation, healing from past wounds, letting go of grudges, personal and collective well-being. right? And then also, the nerd in me wanted to share another fun fact. 2025 is a perfect square year, right? So it's also a year that is almost rare. I think the last time it happened was 1939, and the next time it's not supposed to happen to 2111, if I quoted that correctly. But nonetheless, 2025 is really about creating a better version of you, right? And it's about increase in technology, changes in the healthcare, and how we can show up better in the world for ourselves. So again, another timely thing to blend in with the whole wellness aspect, right? We all looking to be a better version of ourselves. So how can we be a better version of ourselves? And we can be a better version of ourselves by, working with me at Into My Health. And some of the things that I can help you with is one-on-one coaching and group coaching, college support, right? I can work with colleges and universities. I can also do corporate programs, research opportunities, supporting research, and then advocacy. Those are just a couple of things that I wanted to point out. And this is just a little bit more details in some of those items and what that impact has. So, as an individual, one-on-one coaching that provides improved health outcomes, increased motivation and engagement, sustainable behavior changes, personalized wellness plans, enhance productivity and quality of life, increase self-awareness and confidence, reduce healthcare costs, and improve your overall well-being, right? And so we all can use the support. We all are in different spaces in our health and wellness journey, and we're all in need of such service. And it doesn't, and again, like I said before, it doesn't matter whether you're in the healthcare system because of a chronic issue, or you just see that you need to improve yourself, or you want to improve yourself because you see the fragility of the healthcare system and what's going to look like in the next 10 years. And oh, by the way, these chronic conditions that many Americans are going to have. So what can I do to help improve myself? And who can I help? Who can I have help me do that? Group coaching, right? The great thing about group coaching is that you guys can hold each other accountable as just as much as I can help hold you guys accountable. You also get diverse perspectives, right? You get to learn from one another and hear what the other person knows, and so that you can learn from them. It's also a sense of community, right? It can be a little bit nerve-wracking coming trying to do something on your own, right? Even though you have me as your coach, at the end of the day, you have to go home and you've got to put in the work. And, that's not always easy for everybody. So I thought it was important to create a space for group coaching, right? Because it also improves health, shared learning, and again, reduce health costs. Corporate programs, right? It helps reduce healthcare costs. Most organizations these days are also looking to reduce costs. Everything's going up, and we're looking to figure out how can we reduce costs. Well, when you invest with a health and wellness coach, that's an opportunity for you to do that, right? So I'm sure many of us have heard the saying, either you pay now or pay more later. And I think most of us, if we can, we would like to try to pay now so that we don't have to pay more later. And so we also have the opportunity to improve employee engagement and retention. Again, we all know that that's a huge thing. I was in leadership and working with many different people. And so just making sure that people stay engaged and feel connected and, stay within the organization is extremely important, right? And increase productivity, right? We have a lot of goals within the organizations, and we want to make sure that those are getting done, right? And if that's not getting done because somebody is needing support from a health and wellness standpoint, well, an easy solution is to just pay into a service and invest in the service so that you can improve productivity. So let's just say it cost you $100, right, to help your team member or your worker improve in the productivity standpoint. But that $100 that you spent on improving that employee generated $1 million in sales. So to me, that's a cost benefit analysis, and it's worth investing in. It also reduces absenteeism. A lot of times people leave work because or out of work because they're stressed, they're overwhelmed. They have a lot of things going on outside, even though we spend most of our time within the workspace. There's a lot of factors happening outside, right? And so if we're making sure that all of those factors are being addressed, we can help reduce absenteeism. And also, which is a big thing, and you saw on the slide when it came to one of the reasons why physicians leave is positive organizational culture. Everybody wants to work for an organization that has a positive culture. And so if having a health and wellness coach as an arm within your organization improves that, again, it it improves the bottom line. It helps the bottom line. It increases the bottom line. And then, being in leadership, I know is always about the bottom line. So this is an opportunity for you to invest within your organization. Colleges and universities, an opportunity to improve the mental health and physical health of the college students, right? You want your kids to be doing well, depending on where you get your funding from, right? It can be dependent on how well the students are, and especially if you're trying to, get some prestigious funding or whatever the case may be, that's an opportunity to make sure that your students are where they need to be, right? It improves academic performance. It empowers students to take ownership, right? I'm a strong believer in holding people accountable and taking accountability myself, and just empowering people. I think oftentimes we just want to do for people, but more often than not, people feel better when they're empowered. If you give them the tools, um, to be the better version of themselves, you'll have better outcomes than just giving them what they need to move from point A to point B. So empowerment is huge for me. It also supports behavioral change, and it also reduces reliance on intensive mental health services, right? So many colleges, I have my ears and eyes in different spaces, and education system is one of those spaces. And a lot of colleges have been closing, right? They're on a financial brink. A lot of them emerging, closing. And if we can find opportunities to reduce costs, why not, right? And one of the things that I've been hearing is, they don't have the counseling services that they used to have at the universities or colleges, and children and students are having challenges that could be detrimental. But it doesn't have to be if you invest with your college or university. Same concept with the business, right? Maybe you spent $100 per kid to enhance and improve their health and well-being, but what did that do to the bottom line, right? That kid, when they graduate in 4 years, right, they can support the endowment and other factors to continue the college going on to where you perceived it to be, or want it to be, I should say. So there's always a cost benefit analysis, and these are, to me, great opportunities of investments to improve the bottom line and overall goal, whether you're a corporation or a college. Advocacy. With advocacy, you provide better understanding of diagnosis and treatment options. You also enhance the communication with the healthcare providers. You increase the patient's engagements in following treatment plans, and you improve access to care and resources. Again, when I was going through my journey through the healthcare system, I didn't have anybody. But I'm a person who don't mind rolling up the sleeves and digging into different spaces and doing the research that's necessary. But that's not for everybody. And everybody, like I said, I chose to go numb so that I can get to where I need to get to. And I'm not saying that's the best practice for everybody. But I think if I probably have an advocate by my side, it will probably move a little bit smoother. And based on the research and the data, they said that I think it's 82% improved outcome in the healthcare system when you have a support system by your side that can kind of walk you through those channels, right? Because it could be scary, right? You got these doctors and the professionals telling you do this and do that, and you're like, I don't even know what you're saying to me. But if you have somebody to just kind of listen in and guide you in the right direction, it goes a long way. Um, another Some other points in terms of improving advocacy is reducing healthcare costs, reducing financial stress, right? When we reduce healthcare costs because we provided the proper advocacy support, we're also reducing financial strains because now that person is not going to the doctor's office, they're not going to the emergency room. And so that's reducing not only just the healthcare costs, but also the financial stress on that individual. It also improves their overall well being, and then it also improves family life, right? Going to the doctors can be very stressful. And who do we take that out on at times? Can take it out on your family, you can take it out on your friends. And but if you had that, because you just maybe you just don't know what to do, but if you had that proper support and somebody guiding you, right, you improve your relationships, not just with your family but everybody that you engage with, right? Because now you don't feel stuck, and you know exactly what's going on, or at least you have a better understanding of what's going on, right? And so you feel better, you show up differently, and you move differently. Having research support improves communications for you as the client and the patient in the healthcare system or outside of the healthcare system. It also builds trust. It shows that I'm not just doing this just to, see your face and let's talk for, 45 minutes or whatever the case may be. No, I want you to see that I'm in it for you, right? I want you to be the best version of yourself, whether you are in the healthcare system or outside of the healthcare system. Um, I'll be providing evidence-based practices and research to you, and it adds to personalized coaching, right? Again, a lot of the coaches' websites that I looked at, it was very simple, very basic. Um, and I wanted to take a step further, right? I'm passionate about a lot of these different things, whether it's research advocacy, the healthcare system, just helping people in general. And I really believe in empowering people. So why not? Like, this is a perfect marriage, right? Doing all of these things. And so I just wanted to end with like a final thought before I show a few more slides. But just sit back for a moment and think, right? A lot's been said, a lot's been shared, but also we get a lot in and a lot of stuff out in society. But what I presented to you is a quick snapshot of our fragile healthcare system, um, us creating problems for ourselves from a health standpoint, right? 40%. The healthcare problems, the chronic issues that a lot of Americans are going to have, but also 80% can reduce or change that avenue, right? If we make some lifestyle changes and improve our health, right? And you don't have to do it alone. Again, it can be scary. So again, whether you're in a healthcare system or outside of the healthcare system, but you know you need some support from a health and wellness standpoint, I'm that person for you, right? Into My Health is personal, right? I have a personal experience from the healthcare system. I know a lot of people that have personal experience, and I tend to give them advice. Um, and so whether you're in or outside of the healthcare system, I'm here to support you. I'm here to make sure that you have a better outcome in your overall well-being, and so that you can be the better version of yourself as you move through life, and so that you can help reduce costs with the healthcare system. You can save dollars in your pocket, right? So you're investing now, right? And we all think we always have time. And the picture a few slides back, that was a picture of me, right? There was a picture of an hourglass, right? Because we all think we have time. But I have that hourglass as a constant reminder that though we all have time, eventually time runs out and things are going to start to catch up to us. So if you have time, regardless of where you are in your healthcare journey, you can always start now to kind of change the trajectory of where you want to go, right? Like I said earlier, a lot of some physicians would say that you can turn on and off chronic illnesses and diseases. You can change your genetic disposition. So those things can change if we make some lifestyle changes. And I'm giving a helping hand. I'm here to support as you invest in yourself, so that you don't have to pay more later, right? Why not, right? And so then what's holding you back? right? And then we can talk about like, well, why is that holding you back, right? A lot of times it's just out of fear of not knowing where to start, right? And so that's where I show up, right? We talk about those issues. I do an intake form and we'll have a strategy call and then we'll move accordingly through that, right? And so as we end and as I devote myself to all of you guys and share one of my favorite artists, Devotion, if you're not familiar with that, it's an Earth, Wind, and Fire song. I think it came out 74. Um, but that song is all about being better, doing better in the world, doing better for yourself, and how can you do better for others, right? And as I devote myself to you guys, and I hope that I've inspired you to devote yourself to your health and wellness, I just wanted to share a little devotion. So I hope you were inspired by their devotion and my devotion to you, and you're going to be devoted to yourself to move forward with your wellness journey. And so the next step will be how to connect, right? Um, and I think I forgot to mention, right? Because I have followers that's following along, and I haven't really shared with everybody um, when. So just like John Legend got his nickname from, people that were around him because they thought that, he was going to be a legend. He is a legend. I asked the universe as I was moving out into the universe, give me a name that is representative of me. And so it presented me with the name Wynn. And Wynn basically means good hearted. And fair. And many people that have worked with me and engaged with me and talked with me knows that I am those things. And so I kind of ran with it, shared it with people, and told them the idea. They loved it. So hopefully you guys love it too that I haven't shared it with. So yeah, this is how you connect with me. You got the QR code that you can scan if you got your phone out. You also have the email address and the website that you can go to. I'm also on the 3 different platforms. I'm on LinkedIn, I'm on Facebook, and I am on YouTube. Right now, YouTube, I can do my business page, Facebook, and LinkedIn. You got to wait a little while to have the business page up for a while. So I'll be functioning through my personal page. But nonetheless, you can still follow the business pages on both of those sites. So when I'm able to function fully through the business site, you're all set. And with that, I want to thank everybody for their time and open it up for questions. We have 6 minutes on the clock. Any questions, Leanne?
No questions over here.
All right. Well, again, I thank everybody for their time. And if you have any questions, definitely reach out to me in the various ways that I've already presented, and or just look me up on the various platforms. And I look forward to working with you all. And thank you, Leanne.
Thank you.